Hey,
Hi.
hello.
How are you today? My name is Maria, and I'm going to be your student nurse today.
Okie dokie.
I'm here to give you an NG tube.
Alrighty.
Okay, I'm going to do a little hand hygiene. I provided for your privacy.
Okay.
Can you please verify your name and date of birth?
John Doe 10/15/55.
Okay, and do you have any allergies?
No.
Okay, and all an NG tube is, I'll explain that while I'm getting some gloves. All an NG tube is going to help you relieve pressure from your stomach. So it's going to go in your nose, down through your esophagus, and into your stomach, okay?
Okay.
All right. Now, before we get started here, have you ever had head trauma, face surgery, anything like that?
No.
Okay, I'm going to check your nose for lesions or anything blocking. Looks good, and throat looks clear. All right, and now I have my supplies. I have lube, I have a towel, basin, syringe, tongue compressor, and this is just in case it gets like cold back there and you can look and see what's going on. I'll need this tube feeding, my 30 milliliters of water per cup, tape, and tube. Okay, so I'm going to prep with my tape. If I can get it to tear. Okay. So prepping this. Okay, this shouldn't be painful, and at any time that you need a break, just raise your hand. Like I said, this is going to go in through your nose, through your esophagus, and down into your stomach. So,
Okay.
not painful, but just not the most comfortable thing in the world. Okay. All right. Hand hygiene. Take this out the package. All right, so I'm going to do what's called a next measurement, and that just means that I'm going to measure this from your nose to your ear down to your xiphoid process, and I got it about 58, and I'm gonna mark that with some tape. Okay, now I'm gonna assess your bowel sounds before I go any further to make sure that this is needed. Expose your tummy just a little. This might be a little cold. And I'm going to assess in all 4 quadrants for a minute each, starting at the right lower quadrant. Okay, bowel sounds are active in all 4 quadrants. Cover you back up. Continue having privacy. Okay, now's down to the sticky part. I'm gonna put this towel here for mess. And there's gonna be a certain time where I'm gonna ask you to put your chin to your chest, and it's just gonna help make sure that I keep my placement. I'm also going to hold your head for stabilization and to make sure that it's going the right way. Okay, so now I'm going to put my gloves on. A little hand hygiene. Okay, I've got my tape. And this is not a sterile procedure. This is a clean procedure because it involves the GI tract. Okay. All right. Now, I need to have you blow your nose. So, which side do you breathe better out of?
My right.
Your right side? Okay. And I need you just to blow
Okay.
Okay, now breathe in this side. That side. Okay, that sounds accurate. Right side. Okay. I am going to hook up this so you don't spew any contents out at me. All right, lube you up. Okay, I need you to, first off, let's scoot you up. That's better. Okay, so I brought it down. Okay, I am going to need you to take a deep breath in. Remember, I'm stabilizing your head with my hand. And at any point in time that you need a break, just raise your hand, okay? All right, 1, 2, 3. Okay, swallow, 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 swallow. Okay, gonna hold here. If I was in the wrong place, I would immediately take this out. Okay, now I'm going to get my tape. Once I tape this, well, first let me check for residual. Residuals just to make sure that I'm actually in the stomach. Struggling. Okay, and I'm gonna put your stomach contents back. Leave the syringe in. The tape's the worst part. Okay, now that I've verified, the most accurate way to verify placement is to have him sent down to x-ray to make sure that it's in the right spot, but I did get residual back, so I'm confident that it's in the stomach, but I would still send him down to x-ray. Okay, so now I'm going to hook you up to suction. Make sure that my tubes are on. This one is connected to the patient. This one's going to be connected to the tube. So we take that off the air vent. Leave this here. Okay, I'm going to turn on intermittent so it's not continuous, and I'm going to turn up anywhere between 40 to 60. Okay, so if I were to give meds, I would turn the suction off, wait 30 minutes. While I was waiting, I would crush up my meds very finely, mix with water in a measuring cup, take this syringe, put it right here, just like this, and make sure to clamp it to keep air out of it. I would flush with 30 mils of water, get my meds, pour my meds. Before it was all the way empty, I would get 30 more mils of water, pour it in there. If he had more than one med, I would flush with 5 mils in between each med. If the tube was clogged, I would want to irrigate per doctor's orders with what I would want to irrigate with and how much I should irrigate with. And so you would irrigate with whatever the doctor said you needed to do, and then you would aspirate to make sure that you have flow going in and out of the tube. Okay, now for, and for meds, you would want to wait 30 minutes to hook this back up. So you would probably want to leave a sign or something stating the time that you turned it off and that you'd be back in 30 minutes to turn it back on to suction. Just something to let them know that he needs to wait 30 minutes before. Okay, so I'm going to come back in for feeding. I'll need to make sure that his tube is in the right place. I did a poor taping job. I will work on that. I'll make sure his tube's in the right place.
Hey.
Hi, it's Maria, student nurse. Can I get you to verify your name and date of birth?
Oh, John Doe, 10/15/55.
Okay, any allergies?
No.
Okay, just gonna grab some gloves. Okay, now I got orders here to get you a feeding going. So I'm going to turn suction off.
Okay.
Okay, and before I do your feeding, I'm gonna unhook your NG tube from the suction tube, flush with 30 mils of water. Just place a new towel here. Okay, so insert my syringe, keep it clamped so no air goes in the stomach. 30 mils of water, undo, let gravity do the work, clamp it before it's all the way gone so air doesn't get in. I have my tube feeding, little at a time. 15, gravity do the work before it's all the way empty. More, and just to avoid any air going in there, gravity do the work, and then clamp. 30 more mils of water, gravity do the work, clamp so no air gets in there. Remove my syringe now that it's flushed after my feeding. Okay, and that's how you would do a feeding. I did verify that my placement was the same. My taping just stays. Okay, now that I've done my feeding, I have an order to remove the tube.
Hey.
Hi, it's Maria, your student nurse again. Can I please get your name and date of birth?
John Doe, 10/15/55.
Okay, and do you have any allergies?
No.
Okay, that's good. I have an order here to remove your NG tube. Yay!
Yay.
So excited. So I am going to get more gloves. Okay. All right, this shouldn't be painful at all. May feel a little funny. That's about it.
Okay.
All right. Turn my suction off. Disconnect my suction. Keep it handy just in case I need to do oral suction. Okay, new towel. All right, remove tape. Okay, and on the count of 3, I just want you to take a breath in and blow out. Ready? 1, 2, 3. And out you go. Okay, we're gonna put this in the trash.
Much better.
Okay, now I'm just gonna clean you up a little bit.
Okay.
Blow your nose if you'd like. Clean you up. Would you like to do some oral care?
Yeah.
Okay. Would you like to brush your teeth?
I'll just rinse my mouth out or something. I don't know.
Okay, I'll get you some mouthwash here.
Okay.
Here you go. Okay. Any water or anything?
No, I'm good.
Okay. Your call light's right here. I didn't need suction, so I'm putting the tube back right here. All right. Just press this if you need anything.
Okay, great.